First, we are going to start with Felicia Stativkas. I probably got that totally wrong. I really apologize. She serves as Director of Zeroing and Prevention Programs at Cascade AIDS Project. The Zeroing and Prevention Program is a Gilead-sponsored program to support HIV, viral hepatitis, and STI services and supports for people without housing, people who inject drugs, and sex workers. Felicia has 5+ years of harm reduction work with our resilient, vulnerable community members who are at increased risk of CD, overdose, chronic conditions, and more. She works with other agencies across the greater Portland metro area to enhance whole person well-being among her client community members. So.
So I do know my name is Greek and it's a little hard to say. So my name is Felicia Stativkas. I work with Cascade AIDS Project. So on this, I have 5+ years of harm reduction experience working through Strolls, Sex Worker Resource Project, hands on the ground or feet on the ground experience. I have 3 years as the Zeroing and Prevention Coordinator with Cascade AIDS Project. So what the Zeroing and Prevention program is, it was created to focus on providing equitable and reliable rapid services for houseless folks who use drugs and sex workers throughout Portland and the greater Portland area. These are people who have historically been ignored or not focused on in programs like Cascade AIDS Project, and they are the most vulnerable. And they also have the highest risk of infection. So we reach these communities through partnership with local organizations who also focus on communities or similar communities, such as day shelters like Hobbs and Rosehaven, showering hubs like Hygiene for All, free clinics like Central City, Outside In, temporary housing services like TPI and all the shelters around Portland they use, street outreach teams like PPOM and Portland Street Response. So that is pretty much what the Zeroing and Prevention program has been. It has been about 3 years, and we've reached a very large amount of people throughout not just Portland, but like the rural areas around Portland. So next, the facts and why they matter, or why harm reduction matters. So 48% of people with a positive HIV status also have a substance use disorder. 68% of people with a positive Hep C status also have an STD. And where that comes together is that an estimated 18 people living with HIV also live with a co-infection of hepatitis. Oregon has the 3rd highest mortality rate of Hep C in the country. Right behind it, I believe it's DC and Oklahoma. That one. I always want to say Kentucky, but I think they're right behind us. And so the primary cause of Hep C and HIV infection in Oregon is going to be through shared needle use. And access to harm reduction services, especially needle exchange programs, decrease infection rates by 50% or more. That is a crazy percent. So places that don't have that can have a much higher rate because they're not giving people access to any harm reduction services. So the North American Syringe Exchange Program estimates that Oregon has 14 active syringe exchange programs, and that doesn't necessarily mean sites. That just means programs. So Multnomah County is considered one program. They might have a bunch of different sites throughout. So we have 14 active syringe exchange programs throughout Oregon. One of the big facts and why harm reduction matters in relation to that is that sweeps and vets, people who live on the street or are housing insecure, that makes it really, really hard for them to keep a hold of their medication and to feel safe with it. And that's going to be a big reason why these your harm reduction strategies that you implement in your agency are going to help decrease this risk. So mistrust and why it matters. Many people who live with an STD, people who use drugs, have a strong mistrust of the medical system. This mistrust comes from not only medical mistreatment, but also a disregard of underlying medical issues, patient jumping, irritation from excessive visits on both sides, the lack of harm reduction knowledge from people in medical spaces. So not even, not implementing it, but a lot of people don't even know that harm reduction isn't just giving people drugs and being like, here, do what you want. It is about keeping somebody alive until they choose to get sober. Through implementing harm reduction into your agency and your personal lives, we can collectively better not only our community, but the communities that we serve. So the language that you use with certain community members matter. Showing that you have empathy and knowledge goes a long way. If you have ever heard the term "we help us," that really means that if you have never, people who are in a bad or tough situation probably are not going to trust somebody who also hasn't been through that. And that's why the language that you use, the knowledge that you have really matters. We help us, we trust us. So previous bad experience, whether first or second hand, play a really big part in how community members interact with our services. I personally am housed and have a good job, but I have severe medical distress because of how they treated my grandma with severe alcoholism. I'm not allowed in a few hospitals because of my push for dignity care, trauma-informed care, specifically with her, who is also a house elderly woman who was put together when she visited the hospital for another thing is remembering that everyone is somebody's family member. Everybody has family, everybody has somebody that they care about or that cares about them, and harm reduction is based on empathy, compassion, and destigmatization. And again, harm reduction really is about keeping somebody alive until they are able to choose sobriety and choose better lives. So training and implementation. So while Cascade AIDS Project does not offer any of these trainings, they are stuff that I personally have taken throughout my time in nonprofits, in working with these communities, and I truly believe that they are essential to like the whole "we help us" and getting that knowledge, getting that information, getting that language. And I'm not going to go through each one. These will be available to you afterwards, but I'll give you like the name of each. So trauma-informed care is a very big one. That is number one that I would suggest. The people that you are going to be working with for the most vulnerable have the most trauma. So trauma-informed care is my number one. Compassionate care is going to be second. Again, harm reduction is based on compassion and empathy. De-escalation, that is going to be the biggest one to keep you safe as well. Being able to de-escalate a situation with somebody who may get violent if the right words, the right situation isn't at hand with them. De-escalation is going to be another one of my biggest ones, and also dignity and care. That is just so important. Being able to care for somebody while also keeping their dignity intact is going to give them more. They're going to want to use your services a little bit more, and they're going to feel more comfortable accessing those services. So personal things that you can implement in your daily life: volunteering for local shelters, day centers, food banks, free food cafes, say like Blanche House, or when just the road is open, that's a good one too. A lot of medical front desk places like CAP does volunteering. I don't know if CCC does, but I believe they might, but a lot of walking clinics and just volunteers to help enter people in and stuff. Donating to your local free fridges. Again, just donating, going by to your local churches, seeing when we're hogs or roasting or anywhere needs donations, going by really can help like see what's going on in your community. And also just interacting with your community. Obviously, you want to stay safe and you want to make sure that you're assessing each situation properly. But you see somebody who is digging through cans, offer them a can of soda, or offer them, do you need a can warmer? I'm going to 7-Eleven, can I buy you a soda? Interacting with the community and seeing that these are just human beings who are in a bad situation, who genuinely just also need comfort and dignity, is really going to change your perspective on this. So some things that your agency can implement is collaborating with local day shelters and temporary shelters for medical needs. Rosehaven has an awesome program through OHSU where the trainee nurse staff get to go in there and work the health center and do wound care, plus feet washes, and really just see what it takes to work with the vulnerable community and get that empathy that I believe should be within every nursing program. Have pamphlets and info available for like local resources, anything around your area you should know about. You should know about all the local resources and have any sort of information you can available. The last thing is hiring practice focused on lived experience. Again, that language that you use, it can be taught, but really the best thing is to hire people who can relate to the people, the community that you are serving. So, moving on. So the resources, most of the people are from Portland, so I don't necessarily read off every single one. Again, this will be available for later. I'll go through the ones to look for. So again, look for a resource that your agency or you can partner with. It's gonna be day shelters, again, real estate rehabs, temporary housing, resource centers, just like street groups, just to go in, get any sort of information, walk-in clinics and testing centers, free food cafes, food banks, showering hubs, warming and cooling centers, depending on the year or time of the year, any sort of wellness fair. CSN is a really good platform. If you don't know in Portland, CSN is a really good one to find with connecting wellness fairs. Syringe exchange programs as well. Again, that's one. And so for rural areas, because this is going to be one that people might not know about, I will go through these. So for Eugene, street routes, well, they are based in Portland. You do have information about all throughout Oregon. Their resource guide is very, very good for that. YCAP is out in, it's Yamhill County. We are helping them with some of their intake services right now. Boulder Telehealth is going to be really good for anybody who would prefer a telehealth setting to get recovery meds or help detox, basically anything like that. Oasis Impacts, which we'll hear from again or soon, or I think we nope, they're next. And then Alliance for Wellness, our community wellness in Eugene. I'm sure we all know about these two, takemehome.org and stdcheck.com. The Rural Oregon Continuum of Care, HIV Alliance, and then the Lavender Network in Eugene just recently started doing HIV wellness services. So the last thing that I would really love to share with you guys is a letter from Jamie, I might say this wrong, Brunin. They're a public emergency service paramedic for Clark County, and I really think that this letter embodies everything that I think harm reduction is and why it matters. So, a letter from a paramedic. I feel stigma is a major issue with some medical professionals, especially in emergency settings or when people call 911. Too often, there's this assumption that patients are just looking for food or warmth, instead of being taken seriously for their medical concerns. And when that happens, real medical issues can get overlooked, undertreated, and even delayed, which is completely unacceptable. Another way I see it is with mental health and substance use. There's a blanket assumption that all unhoused people are drug using, which isn't true. And even when someone does have a history of use, their symptoms often get mistreated. If a patient comes in with delusions or hallucinations, providers may assume it's drug-induced psychosis, which sometimes the drug use actually started as a self-medication for a pre-existing condition. When that assumption is made, the underlying mental health issue never gets treated. And I know you only asked for two, sorry, that was to me, but I think this last one I feel is super important. Too often, unhoused people aren't treated like full human beings. They have feelings, they have families who love them, and they deserve dignity. I always say if providers treated patients like they were being tipped, we'd see a whole different level of care. There are so many barriers that people with substance use disorders face, and a lot of them go unseen by those of us who haven't lived it. Depending on where someone is in their addiction, they may have lost nearly everything. Their family connections, their phone, their car, and even the basic tools most of us use every day to get things done. So for something that seems simple, like calling to schedule a bed for inpatient detox, can actually be impossible. On top of that, there are systemic barriers, whether insurance can cover detox, whether there's even an open bed, and what happens afterwards. Getting sober is one thing, but staying sober is another, and that's where the social side becomes a huge barrier. Many people have built their whole support system and social circle around others who are also using. When they try to step away from that, they felt they're left isolated. It can feel like they've lost not only their coping mechanisms, but also their community, which leads to depression and loneliness. So yes, the obvious barriers are the socioeconomic ones, the loss of stability, resources, and access. But just as important are the social and cultural factors. Recovery isn't just about detoxing from a substance, it's about rebuilding your entire life and support system from scratch, which is an enormous challenge. So thank you guys so much for listening. I really appreciate it.
Okay, so she's going to be hanging out, and please see